The race between infection and injection is on. But immunising the global population against Covid-19 presents an unprecedented challenge.
No one's ever tried to vaccinate an entire planet as fast as they're trying to do it now.
The rich world has most of the global vaccine supply, prompting many countries to turn to Chinese and Russian jabs when it's not yet completely clear how safe or effective they are.
It might turn out that these are really great vaccines, but unless you see the underlying data, you can't be absolutely sure.
Will gambling on these jabs pay off? Or could it have negative consequences for the great vaccination drive? New mutations of Covid-19 are placing health systems under increasing strain. And the stakes are higher than ever in the global vaccination race.
It's amazing we've even got these vaccines at all. This has happened in under a year. It's a miracle, I think.
The challenge for the world now is how to supply and distribute these vaccines. Just a handful of countries have managed to give a first dose to over 5% of their population. And some vaccines are easier to distribute than others. Of the 3 jabs to have been approved for use by stringent regulators, 2 made by Pfizer, BioNTech and Moderna require storage at low temperatures, making them more suitable for use in the rich world. Israel is leading the rollout of the Pfizer jab. Just over 30% of the population have received at least 1 dose, making them the most immunised nation in the world. Israel was helped by a deal with Pfizer, which gave it access to jabs in exchange for data about how the vaccine was working. And the country's size and population density also helped.
Israel's a small country, and distributing the Pfizer vaccine is easier when you can move it around without it heating up and spoiling.
The third vaccine to receive authorization from stringent regulatory bodies offers hope of wider and faster distribution. Developed by AstraZeneca and Oxford University, it can be kept in a normal fridge.
The AstraZeneca vaccine is the vaccine I think that most of the world will use. It's cheap, it will be plentiful, and will be made in lots of places around the world.
But rolling out this vaccine poses 2 big challenges. First, many poorer countries will struggle to get it into arms quickly and safely.
It's much more than just flying them to the airport. Even though the Astra vaccine is suitable because it can go in a fridge, even India is going to have a real cold chain problem.
And the second problem is that the vast majority of these jabs have already been snapped up by the rich world. 3/5 of the 2 billion confirmed orders of AstraZeneca doses will go to high-income countries, along with all of the Moderna vaccine and almost 3/4 of the Pfizer vaccine. Even taking into account the high death rates in the rich world, some nations pre-ordered significantly more than they will need. America ordered enough to vaccinate the population twice over. The UK ordered enough to vaccinate the population 3 times. And Canada, where deaths have been relatively low, ordered enough to vaccinate the population 5 times. The Director General of the World Health Organization has dubbed this hoarding a me-first approach, which could increase suffering and prolong the pandemic.
Rich countries ordered more vaccine than they need. They, at some point, are going to have to donate some of it. The question is, when are they going to donate? That is a political question and will depend on the mood of the countries involved.
The good news is that there is a scheme to make sure lower and middle-income countries have access to jabs. It's called COVAX and works like a global vaccine buying club that allows rich countries to subsidise vaccines for poorer countries and pool demand to get better prices. Following his inauguration, President Biden was quick to announce America would join the group of 190 participating economies.
The big hope in COVAX is that about 3% of each country's population will have got adequate supplies of vaccine by the summer. That's roughly the number of healthcare workers in most countries. That's quite a lot, but not enough by any means to vaccinate much of the world's population.
That leaves a large global shortfall in safe and effective vaccines. And in an attempt to make up for this, many countries are turning to China and Russia. Both nations have made vaccines which they say work and are safe. The problem is it's hard to know if that's true.
They were approved before having gone through phase 3 trials. It might turn out that these are really great vaccines which would be really good for the world. But unless you see the underlying data, you can't be absolutely sure.
Governments desperate to immunise their populations have been making deals directly with the jab developers to host clinical trials in exchange for vaccinations.
将作为全球公共产品，优先向发展中国家提供。
Chinese vaccines are being used or trialled in several countries around the world, including high-income nations like the United Arab Emirates and Bahrain, which are just behind Israel in terms of the doses of vaccine delivered per head. That's good news for China, but it's raised concerns the country may be exploiting the vaccine rollout for political purposes.
The pandemic is such a kind of global event that inevitably soft power becomes a factor too. If you look at the way China has been doing deals with countries to give its vaccine to, say, countries in the Middle East, it's part of a move to try and build relationships with those countries.
The lack of transparency around some of these trials is worrying. The full Sinopharm trial data from the UAE were never published, and tests of a different Chinese vaccine in Brazil have also raised questions. A jab made by Chinese company Sinovac was initially found to have 78% efficacy, but this was later downgraded to 50%. Just clearing the threshold for emergency approval from regulators.
None of these countries are free to disclose their data in the way they would like because they're bound by contractual arrangements with the Chinese. So they can't tell us what we want to know.
This lack of transparency has important knock-on effects on trust, and trust in vaccines is crucial for making them effective.
Trust is what determines how many people are willing to take the vaccine. Maximum trust depends, I think, on maximum transparency.
The vaccine rollout that has perhaps raised most concerns around trust has come from Russia.
Сегодня утром впервые в мире зарегистрирована вакцина против новой коронавирусной инфекции.
The vaccine, named Sputnik V, was authorised in Russia last summer after being tested on just 76 people, and has since been cleared for emergency use in 14 countries worldwide.
It's no accident that the Russian vaccine is called Sputnik V, a reference to one of the great soft power triumphs of the Soviet Union in getting the first man-made object into space. It was the first vaccine to be announced, and frankly, it was rushed out. In some ways, it was designed to burnish Russia's reputation, but the fact that it went to those lengths and cut those corners has done Russia's reputation no favours.
Getting the vaccine rollout right matters. Modelling suggests if jabs are distributed according to global need, rather than being concentrated in rich countries alone, it could save 1.5 times more lives. But doing this will require levels of global cooperation that have been lacking in recent years. If the world gets it right, it could pave the way for greater collaboration on issues like climate change. Get it wrong, and it could deepen the cracks in an already fragmented global system.
If it's seen that the pandemic has been dealt with well and fairly, and that the mechanisms for governing the world have functioned, then that's an enormous vote of confidence. But if the pandemic is seen as selfish and fractious, it makes all those other issues much harder to deal with. I'm Edward Carr, The Economist Deputy Editor. I hope you've enjoyed this film. If you want to read more of our COVID coverage, please click on the link opposite. And keep an eye out for The Jab, our new COVID podcast. And don't forget to subscribe.